Assalamualaikum, my name is Nubata binti Aludin. My program is CAD 228. So today, I want to talk about obesity. What the meaning of obesity? Obesity is a heart condition where excess body fat accumulated to a level that can affect a person's health. Why did I choose the title? I chose the title because I have been body shaming. This happened when I was in high school. I have a rather body fat. Because of that, I was shamed. So today, I want to talk about disadvantage of obesity in life. My first point is high blood pressure problem. High blood pressure, also called hypertension, the pressure that is higher than normal. Your blood pressure changes the based on your activities. Having blood pressure problem measure consistently above normal may result in diagnosis of higher blood pressure or hypertension. A total of 6.4 million Malaysian adults are now suffering from higher blood pressure problem or hypertension, which is even worse when no one they have a disease. And the Direction General of Heart, Dr. Noor Hisham Abdullah said, towards the National Heart and Mobility Survey in 2019, it was found there are 6.4 million people with higher blood pressure, with an estimated 3.4 million individuals already aware, will arrest to do not. And there is a fatal high blood pressure. Number 1, genetic. Causes high blood pressure problem at young age. Some researchers believe that certain genetics in your DNA can also cause hypertension. A small notice can be done to change your genetics, but knowing there are family members such as parents, grandparents, or siblings who have hypertension can continually help to determine if you may a risk of this as well. And then excessive salt intake. In general, excessive salt intake, either direction or from salt containing in processed food, will increase the risk of developing higher blood pressure. The American Heart Association recommended a daily salt intake in less than 1500 mg. However, this is said that more individuals in the country consume more than 400 mg for salt per day. Number 3, lack of potassium in the body. In excessive salt consumption in the said to be a cause of high blood pressure. On the other hand, lack of potassium in the body can also one of the causes. Individuals who consume potassium in the balanced amount will be less at risk of exponential high blood pressure problem. Number 4, medicine are also causes of high blood pressure. Certain medication can also be effective in causing high blood pressure. Taking certain medication will increase the risk of higher blood pressure as a side effect. Number 5 is kidney problems are also among the causes. The kidney is very important organ. This is responsible for carrying of the function of getting rid of waste product and toxins when you urine. But kidney that are problem with not able to function properly. Impact of higher blood pressure. Number 1 is kidneys. This is blood pressure can damage the kidney and further affect the function to a kidney to remove waste from our body. Number 2 is heart. Also, the heart will pump harder for need to oxygen to the dead if the heart were out a long period of time. It will experience extreme stress and heart failure will occur. Number 3 is brain. The brain will receive less blood and brain cell will gradually die. The patient will suddenly experience signs of stroke to the uncontrolled hypertension. Number 4 is eyes. The eyes is one of the organs is always affecting the hypertension to the blood vessel. Damage in more serious case and patient may become bleed to the destroyed eye stroke. My second point is asthma. Asthma is causes a chronic inflammation on the airway. The inflammation problem is part of our body defense or immune system. Factors can trigger the disease include number one is lung and respiration tract infections such as flu. Number two is allergic to animal foods, flour, mints, and pollen. Number three is exposure to airborne substances such as chemical pollution, smoke, and air pollution. Number four is weather factor, cool, windy, hot, dusty, humid, and drastic temperature changes. And number five is room conditions are damp, moldy, and dusty. Number six, stress. Number seven, excessive emission, such as burnout, sadness, excessive anger, and louder. Number seven is physical activities such as sport. Action to be taken is suffering from asthma. Number one, admission to hospital or requiring referral visit to heart facilitate asthma in the chronic disease and more asthmatic suffer from it for life. Patients with chronic disease usually require frequent visits to heart facilities for monitoring purposes. For asthma control can be require asthma attack, and this attack may also require further hospital treatment. Number two, taking medicine and their side effects. In case heart rate can cause husky voice, insomnia, sore throat, ears effect in the mouth. In addition to required medication and its side effect, the cost of medical financing for asthma patients can also be a burden for patients and their caregiver. Patients with asthma at severe level can also require monitoring and sternal activities. So, because of that, this is the way to avoid obesity. Number one is to do the check, healthy check for every month, for every year at least. And number two is taking slimming medicine. Refer to my point, I hope I can clearly to make idea about disadvantage of obesity. I hope we can discuss this kind of obesity. I hope also people can also follow the pyramid, diet pyramid when they take a meal. That's all from me. Thank you.